The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. Christine Westerlin here at the Illinois Association of Community Action Agencies. So happy that you're here with us today for our DCO ICA collaboration webinar, and I think we have a great webinar here for you this morning. Katie Kajowski and Muska Cameron are from NASCASP are with us discussing community transformation work. And I think this is so important for us to really dive into the mechanics of this, to understand how is it that we do this work. I always take a pause and remind all of us that it is no accident that community drives what we do. And I think this is an opportunity for us to hear a little bit of it from a deeper perspective, and perhaps I'm going to say broader as well. They can do both, right? To kind of tell us exactly what is it that we need to be thinking of and organizing ourselves around. We already do quite a bit of work in our communities, and we want to really kind of, again, dive into this from a deeper perspective. I would ask that all of you would ask questions using the dashboard that is made available to you, and to let you know that all attendees and all of those who registered will receive a copy of this recording and also the slide deck from this presentation today. But all of you will be muted, and I'll be keeping an eye on the questions for our two presenters today. And before we get started, what I'd like for us to do is to say the promise of community action. Again, you may say it silently or say it along with me, but again, I think it's an important part of the work that we do to center ourselves on this work that we do and to really pay attention to the meaningfulness of what this promise means. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So without much further ado, I will turn this webinar over to Katie and Muska, and so give me just a moment to do that. And there we have it. Muska and Katie.
Okay, good. You've got it. Well, good morning, everyone, and thank you, Christine. We appreciate that warm introduction. We are here with you today from NASCASP, the National Association of State Community Service Programs, to talk about community transformation work. I am Katie Kajowski, the Research Director, and I am here with Muska Cameron, our CSBG Project Manager. Do you want to say good morning, Muska?
Good morning, everybody.
And we are very happy to be here with you to talk about community transformation work, and specifically in the context of the HCCT grant, the Human Capacity and Community Transformation Initiative. Next slide. Actually, maybe if you can just go to 4 and we'll start there. So we want to provide you a little bit of background. So recently, this HCCT Center of Excellence grant was released that replaces or is the new RPIC grant, the Regional Performance and Innovation Consortium. So that grant you all applied for collectively through your state association. That grant was awarded September 30th, 2019. And the reason this is important is because there's a focus in that grant on community transformation work. That's one of the many things that are involved in there. And this will become more important to you all collectively as you, as a state, look for 1 to 3 initiatives to participate in a national effort that will include targeted TNTA, regional collaboration, et cetera, around this community transformational work. And under this grant at the national level, there will be broader TNTA provided to the network on community level work on these community transformation efforts. Next slide. Like I said, it will have a focus on community level approaches to transforming communities. The grant specifically calls out the core values of dignity, society, work, responsibility, impact. These are some things that we all collectively are learning more about in this grant. So unfortunately today we don't have all of the answers, but I think we can set a baseline for having this conversation. Year one of the grant is a planning year, and OCS has been open about that. So you all will work with your state association and your state office on figuring out what is Illinois going to put forward for this community transformation work. Again, in that planning year, really looking at what is going on across the state in terms of community transformation, something that you all might want to focus on with TNTA and how you'll approach that as a state. So next slide, please. And I believe I'm going to turn it over to Muska to talk a little bit more about some of the specifics in that grant.
All right, thanks, Katie. So with this new grant, this network is being asked to identify, highlight, and support community transformation efforts in each state. And so in this next session, we are going to go through the definition of what community transformation work is, what that looks like, and we really are going to break that definition down for you so that you can easily identify what a community transformation initiative looks like. But before we do that, I wanted to take some time to go over why there seems to be more and more of a focus on community transformation. I know with the new annual report, we have Module 3, which seems really foreign to a lot of people because it's a lot of narratives and whatnot. But if you really think about it, community level transformation has always been a part of our history. If you ever, read the CSBG Act, when you have nothing else to do, right? If you read the CSBG Act, you'll know that community action is tasked with focusing on the root causes of poverty. So helping individuals and families with their own poverty, but also just addressing the root causes of poverty in the community. And we have been delivering on that. In the old IS, we did have a few NPIs that agencies across the country were reporting on, whether it was the houses added, the jobs added, and those were community level indicators. So we have been reporting on that to an extent. And I know since Module 3, when we started having these conversations around the country through TNTA events that we've had, that when we've been talking to agencies, there have been some really cool things happening out there. I mean, we were talking to an agency in Pennsylvania recently that was basically reviving an entire town. I mean, their local government was bankrupt, so they were stepping in to fulfill duties that the local government wasn't able to do. So, there's a lot of cool stuff already happening out there, and they were doing that work before Module 3 became a thing, right? Module 3 just is a space for them now to talk about that work, but they were doing it beforehand. So we know it's in our history, and it's going to continue being a part of our future. The main reason we're meeting today is because there is this new human capacity and community transformation initiative from the federal government, Office of Community Services. So it's just going to continue being more and more a piece of what we do, and we have the tools now. Like I said, we do have Module 3 now, which is your community transformation report. It's a space for you to tell that story, of all the work you're doing to transform your communities, and it's also a great planning tool, where you talk about, here's our goal that we're reaching for, here's how we're going to measure that and our targets, et cetera, and you could use that every year to see where you're at with your targets. And we know it isn't easy. Communities are not going to be transformed overnight, right? It's going to take a while, it's going to take years, and it's not going to happen just by yourself, just with one agency doing it. We need community partners, and we need to learn from other communities. So it is expected that when you are engaging in a community level transformation effort, that you are engaged with a lot of partners. Now, nothing is ever black and white, I like to say, with Module 3. So I'm sure there could be instances maybe where it's just an agency, but for the most part, we do expect that there are partners and that there's strategic partnerships. It's not just that, oh, we all happen to be working towards homelessness, but there's a coordinated effort there and shared goals. So that's just some background on why we're talking about community level transformation. And to continue with that background, so part of the problem that is driving this increased focus on community transformation is that despite the efforts made within the CSBG network, poverty, unemployment, education, asset building, affordable housing, all of those continue to threaten independence and economic mobility and increase Americans' need for safety net programs. So I guess to put it visually, is as a network, we've been doing a really great and effective job at providing services to individuals and families. But if you look at this visual, I mean, there's only so many people you could help to get this one house that's available, right? You could provide services to, you know, John Smith and Jane Doe, and they could get this one house that's available, but there's still a huge gap there and a huge need for services there because the community structure is just not there to allow for everybody to be able to benefit off of it. So given that this is the problem, you know, we, as a network, we now need to start thinking about a slightly different approach. And so this approach, as identified in this new grant, is that coordination is needed to identify, highlight, and support multi-year community transformation efforts that move individuals, families, and communities towards improving human capacity, reducing dependency, and sustaining self-sufficiency. So what I mean by different approaches is that right now, I feel like as a network, we're in this blue box a lot, right? With work in the community. And there's a difference between work in the community and work at the community level. So work in the community is providing services to the individuals and families that make up the community. So I feel like as a network, we're still very much in this blue box, and we need to start thinking a bit more about what's in this orange box, which is work at the community level. And that is about changing the conditions and the environment where households with low incomes live and work. So what do we mean by environment? You know, it's the assets, infrastructure, capital. It's about transforming structural causes and factors that are contributing to poverty. Or it's about addressing community-wide statistics, right? So not just an individual's unemployment problem, but the overall unemployment rate in the community or the overall lack of jobs in the community. And we're doing this through a coordinated and targeted effort at multiple levels of society. So these are just two different approaches. And I want to emphasize that it's not that one approach is better than the other. It's just that the both are needed to, for us as a network to be more effective. So like, you know, like riding a unicycle is obviously going to be much harder than riding a bicycle, right? So we need both of these things to really feed off of each other and make us more effective, which is, you know, one, providing services to individuals and families, but two, also changing the community structure so that it allows for more people to benefit in the community. And so the outcome ultimately, especially with this focus on human capacity in this grant, the ultimate objective is to directly measure the growing capacity and resilience of individuals, families, and communities, and the reduction of dependency on external support. So basically the ultimate outcome is to move people out of poverty. But this new focus is on transforming or redefining how our communities provide support, so how our communities make that more possible to meet this objective. So it's about moving the needle around a community and societal problem to enhance human capacity overall. So again, going back to visuals, you know, if we're addressing things at the community level, if we're transforming communities, you know, now if you count, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, you know, now we have 10 times the housing available there, you know, whether that's we built the houses or whether we changed policy, so now there's more housing available there. That means we can help 10 times or more people. So obviously if you know, move the needle around a community-wide problem, you're going to be able to help more and more people, which is going to increase human capacity overall. So that is just a bit of background on how community transformation fits in and, you know, works along with improving human capacity overall. So I'll pause there just for a bit in case anybody had any questions about any of this. And like I said, and like Katie said earlier, is we're all still waiting for more guidance on like specifics from OCS. But as of right now, I mean, this is how we really see community transformation fitting into human capacity work.
I don't see any questions coming in. However, I have one. So is this something that perhaps an agency who already is doing what they perceive to be community transformation work, and it truly is that the community itself is being transformed, is that something, if that program already exists, is that something that can fit into this grant?
If it is something that they are working on, like even if they started, you know, a year ago or whatever, but it's an ongoing initiative, it's still going on and they're still working towards a goal, then yes, they could still report upon that in Module 3 as a community transformation effort.
Okay.
Yeah, and I just want to add that really the only guidance that we have so far is the grant announcement, the application.
Right.
And so that's what we've been working off of in terms of understanding this and communicating with the network on HCCT work. And in there, I didn't see anything, or I should say, there wasn't anything that was specific to a time frame. So if something, like Muska said, if something is ongoing in the state, I mean, as far as we know today, that would be eligible to be, you know, one of the initiatives that you could put forward.
Okay, so that leads me to one more question then. So many of our communities, and I think this might be something that's being done across the country, are being engaged in a program called Safe Passage. I'm sure you maybe have heard of this. This is where the police departments in the cities, fire departments, what have you, are organizing around if you have an addiction, albeit drug, alcohol, whatever, that you can go to a police officer or a member of any safety unit within a city or village and present yourself, and they will help that individual connect with addiction services, addiction remediation services, I guess I should say. And I think in some ways that is being viewed as community level work because it is addressing a community-wide problem, especially with the opioid use crisis. Is that something that you could fit into community level work, or is that more connected to individual work?
Well, I think certainly reducing, I guess, an addiction rate could be. I mean, as Muska said in one of her recent slides, is that tracking, what was that language? Sorry, tracking the percentage, the statistics in a community. That is what we're looking at for community level work.
Okay.
Maybe let's go to the next slide. This might be a really nice segue to talk about the parts and pieces of this community transformational work. This chart you see on your screen grew out of a learning community that the partnership did in 2016 on community level work. And what they found was this definition that's also supported across the industry of what community level work is. So like, you know, Annie E. Casey and other organizations that are heavily invested in this. And there's three key components to the work. One is addressing a community level need, right? The next is resulting in community change that is observable and measurable. And then including community stakeholders that engage external stakeholders. So to your question about the initiative that is reducing addiction, I would go back to this and say, what is the community level need that's being addressed? What is this observable change? What are you tracking? If you're tracking the number of people that say are helped via a treatment program, I might say that individual and family level work, because that's what you're tracking. If you're tracking a reduction of the addiction rate, I guess, and reducing overall addiction in the community, I would probably say that is community level work. Um, anything else you want to say about that, Muska?
No, you said it perfectly. I think it depends upon what change you're measuring, and whether that change is at the community level or the individual and family level.
Yeah, and let's go to the next slide. So when we're going to break this down just a little bit more, right? So if one of the components of this community transformational work is addressing a community level need, like what does that really need? So if we take a look at this chart on assessing the need, a community condition could be that the community lacks living wage jobs, okay? Well, if I'm truly adjusting that need at the community level, then I would need to be increasing living wage jobs, increasing the available positions in the community, which is very different than increasing the number of people who get the job, right? And that would be your individual and family level work, your goal, your outcome that you're trying to obtain there. Looking at this a little deeper, again, another example is addressing affordable housing, right? That's our community need, that there's no affordable housing in that community. So to address that at the community level, we would work on adding housing units, which is very different than helping people get into the housing, because if there's no available housing, we can't help people get into that housing. Next slide, please. And sometimes to get there, we have to think about, the 5 whys, for example. So if the need is unemployment, why is that a need, right? What is going on? Is it that simply adults don't have the skills that are required to obtain a job? Is that why we might have unemployment? And then our work would be to help people obtain those skills to get the job? Or is it really that the jobs aren't even available in the community? So when we look at our needs assessments, we really need to be cognizant about drilling down to a deeper level of that need, right? Simply saying that food insecurity is a need, well, that's probably true. I believe that food insecurity exists in every community. But as you ask yourself, well, why is this a need? What is happening around our community that food insecurity is a need? Is it that families can't afford food and we just need to help them through food pantries or backpack programs? Or is it that the community is in a complete food desert and there is not even access to emergency food type of services? So I think as we're embarking on this deeper community transformational work, it is very critical that we go back to those needs in our community needs assessment and really take a deeper look at what they are. And that we can't simply put a domain down for the need, that we have to drill down to figure out what is happening in that community that we need to address. Any questions on that?
I don't see any questions coming in.
Okay. I am going to turn it over to Muska.
All right. So like we said, there are 3 parts to the definition of community level work. The first is community need, which Katie just walked you through. And the second piece of it is going back to that conversation about the community change and what is it that you're actually measuring. So what do we mean by change? Oh no, my computer. What do we mean by change at the community level? What does community transformation mean? And again, it is when structural issues in the community are ameliorated or when a community-wide issue changes and it impacts community statistics. So structural issues, again, maybe there are policy issues or whatever impacting lack of affordable housing, or just, there just aren't enough affordable houses built in the community, et cetera. Or focusing on community-wide statistics, like going back to the example you showed, Christine, like the opioid death rate or substance abuse rate, et cetera. All of those, when you're looking at something at a community-wide lens. So when you're thinking about whether something is community level, you do need to think about where the change is occurring that you're focusing on. Is it just a change in the individuals and families that are receiving a service, or is it actually changing the community in a structural and more deeper way? And so some examples we have of going back to that idea of working in the community, with community members versus creating community transformation, and you're actually changing the environment in the community. So we have on the screen listed a few examples of really awesome and great work in the community, because you're helping a lot of people and you're working with community members, but they don't necessarily in and of themselves produce community level change. So a job fair is one of those examples where it takes a lot to get a job fair up. You have to bring a lot of partners and whatever, a job fair, a health fair, any of those. But at the end of the day, your target is in helping individuals and families get connected to a job or to health resources, etc. And that doesn't really change a job fair isn't going to change if there's this larger issue with unemployment in the community. A job fair by itself is probably not going to change an unemployment rate. A job fair in and of itself doesn't change anything in the community. So, it's just an example of work that is happening in the community, but not necessarily producing community level change, but they could be strategies towards community level change. So a job fair plus some initiative to bring in employers, etc., all of that together could lead towards changing something in the community. And that could be a statistic like the unemployment rate, or it could be a count like we're adding jobs to the community. So again, you could go through that list similar with a poverty simulation. Again, it's great work, but what is the change you're measuring? A lot of times the change you're measuring in a poverty simulation is the change in perception of the people that participated in the poverty simulation. So that's just those specific people, but it's not necessarily indicative of a community-wide change. And again, a poverty simulation could be a strategy, but it's not the ultimate change in and of itself, right? Communities are not saying we need poverty simulations or we need job fairs. Communities are saying we need jobs. So you could go through that list and it'll be the same thing where helping to provide services is not a community level change in and of itself.
And one of the things that Muska was just talking about is being able to measure that change. And that's also one of the key components of community level work, is having that data, right? The data piece is very critical. And that is also one thing that, we're learning more about, right? Because even though we've been doing community level work for over 50 years, we haven't had that data to back up what we've been doing. In our old report, it was really hard to tell exactly what community action agencies were doing because, for example, say you might build a community center of some kind that will take you 5 years, but you only get to count one. And we couldn't quite tell what was in that report. So we're just getting into this new enhanced Roma Next Generation with an emphasis on evaluation, analysis, and data. And so we hope that over time that we'll have that data to say exactly what we're doing at the community level. And for those of you that might be Roma trainers or implementers, you of course know the baseball analogy, that we know somebody is a good hitter, right? Like we've had years and years of that data to track, somebody who is good at playing baseball, right? And we're just getting into that phase now where we will have the data over time to talk about success, to talk about the community level change that community action agencies are doing. Next slide. With Module 3, we have a more extensive list of community level indicators, the CNPIs. that can be used to track that change over time. And this is something that's very different from the old NPIs in 2.1, 2.2, et cetera. Next slide, please. Let's take a look at what these look like. In this new listing of NPIs, we have counts of change and we have rates of change. And if you look at some of these things, I mean, we're tracking things added to the community through counts, number of affordable housing units added. We're also tracking the rates of change, a decrease in the rate of homelessness, an increase in the rate of home ownership. So with this data, we hope that we can become like baseball, where we know what's successful. We know exactly what the community level change is. And we know that community action agencies are doing it. And then we will now, moving forward, have the data to show that. So again, something that is really critical when we're talking about this community transformational work is having the data to back up what we're doing.
And so those were two pieces of the definition so far, right? One was, what is a community level need? And then the second was, what is a change at the community level? And we talked through, being able to measure that with these indicators. So if you have that, you have the first, so you have a need, you have a change, and an indicator, let's say homelessness as an example. We have a community issue with homelessness. We're going to look at the homelessness rate. Does that make your work community level? Are we done there? But there's a third piece to that checklist, and that's that you have to have strategies and consider those strategies before you make this decision. So just because you selected an indicator, and in the example I'm using, homelessness rate, that doesn't mean that the initiative is engaged in community level work, because you need to include strategies that are likely to bring about that desired community change. So, if I can select the CNPI for homelessness, but if all I'm doing is providing services, that in and of itself is probably not going to really move the needle on that statistic, and you need to engage in more community level strategy. So an example that we have, again, we were talking to this agency and they shared what they did. So there's an agency in Oregon that identified a need to address the homelessness rate, which is a community-wide statistic. So there we go, we have a community level need. And the change they were pursuing was to decrease the homelessness rate. So there we go, that's an overall community-wide change. And their initial strategy was to increase the number of shelter beds. And we've seen a lot of initiatives like these just in us reviewing the Module 3 submissions that we've received, is where we see something and, we see a strategy like this and we just pause for a bit, not because there's anything wrong with the strategy, but we pause because we think, is this enough? I mean, if you just increase the number of shelter beds, let's say you add 10 shelter beds, I mean, is that really likely to change the overall homelessness rate? And those are just some questions that we ask ourselves as we're reviewing initiatives. And this agency actually, when they did analysis of the data, they were able to show that increasing the number of shelter beds actually would not alter the homelessness rate one way or another. So they actually did some really cool analysis there, and they were able to show that. And then they did some further analysis and they realized, okay, but if we increase the number of shelter beds along with multiple other strategies and services to ensure that there was a high turnover rate of the shelter beds, that would actually move the needle on the homelessness rate. So this is just a great example, I think, of, you need to have a need, and then you need to have a change that you're able to measure in one way or another through an indicator. But you also need to have strategies that are going to help you get towards that change. And oftentimes, it's not going to be just providing services. You're going to need strategies at a community level. And then in a few slides, Katie will walk you through a bit more about the definition of what a community level strategy is. But again, just to emphasize this point, if you look at this chart, so choosing the right strategy, if we talk about the high unemployment rate, again, adding an employment training program is probably not going to get you, probably not going to move the needle on that high unemployment rate. But if you're increasing living wage jobs and you're, really increasing the number of positions available in the community, and then you have an employment training program helping people, all of that together could maybe get you there. If we take a look at that last example on poverty level, we will go through an example later in this slide about an agency that is targeting a change in the overall poverty level. So, they have lots of partnerships, and when we mean about partnerships, it's not about simply implementing a referral system, right? We did see a lot of examples like these in our review where folks said, we're just gonna have partners where we refer back and forth for services, which is great, and again, you definitely should do that. But just referring back and forth for services, again, is not necessarily going to get you towards reducing the poverty level. But if you're bringing together a task force of various stakeholders in community, and you're creating a community-wide strategic plan that is reevaluating gaps in services and rethinking or reorganizing how, all the different partners are delivering their services, and you have a targeted goal that you're trying to reach, that is definitely community level work. So again, just make sure that you're choosing the right strategy that will get you there. And now Katie can walk through more on what we mean by strategies.
Right. Thanks, Muska. And the strategies, as Muska was saying, are really critical. I like to say that strategies equals partners, because that is what partnerships bring to the table, are strategies. It's the things like Child Care for All campaign, a job fair, poverty simulations, coalition building. There's a really nice listing of what all of these strategies are in Module 3. And there's also a place to write things in, because there could be a number of other strategies. But these are very different than services, right? Like a resume writing, skill building workshop, or school supplies. Those are our services. But it's the strategies that bring these stakeholders together. It's the campaigns that you're doing. It's the shelter beds, for example, a number of things. Next slide. And like I said, the strategies equal partners. Partners equal strategies. But it's more than that. I think Muska said it's not just the organizations that you might refer people to. These are groups that are coming together with a common agenda, a targeted outcome, with a like-minded approach to the work. Now, each individual partner might do various things. They might even be working at the individual and family level, but collectively with that common goal and agenda, they're working towards changing the statistics in a community. Is this you, Muska, or is this?
I can go. So basically, I guess just to summarize then, the need, the goal or change that you're pursuing, and then the indicators that you're using to measure that change, and the strategies, they all should align together to help you get towards what community transformation would be. So now we're just going to go through some real life examples, and these are all pretty cool. So this first example is about adding SIX transportation in Clinton County in Pennsylvania. This is a different agency in Pennsylvania than the one I mentioned earlier, but basically this agency did a community needs assessment, and they identified the need for a fixed route transportation. So transportation was limited. It just wasn't going to where people identified that they most need to get to. So this agency brought partners together and worked with the county commissioners and this other larger nonprofit in the area, the River Valley Transit, to establish a route. So the fixed route was established, and people were finally able to access employment and medical care, and now there's this transportation route that wasn't there before. So we're adding something to the community, right? So they're counting that route, that one route. They're not counting the number of people who benefited, but they're counting the addition of that route. And I think this is a wonderful example because a lot of times the question we get is, well, once we go through the definition, they're like, oh my God, this just seems so involved. Like, how are we going to just transform a community to something else? And we're a small agency, we don't have capacity. And I think this is a really beautiful example of how the agency identified a problem, they identified what change they needed to make in the community, and it was, this addition of a transportation route. And then they're not the ones who added that transportation route. They brought the partners together that, would make sense for this project, and then basically brought it to River Valley Transit's attention and other partners' attentions, and then River Valley Transit identified, okay, well, we have the capacity, we can set up this route. But at the end of the day, this would not have happened if this one small agency had not brought the partners together. So again, it's a great example of how partners are working strategically towards a common goal that they have identified already, and that they know what they're measuring, right? They are measuring the addition of one transportation route, and the agency wasn't the one who set up the transportation route, but they were a part of this effort. And another example we have is going back to, substance abuse or opioid deaths. So in Idaho, there is an agency that is targeting reducing the opioid deaths in their community by 50% by the year 2021. So as you can see already, they have a clear change identified. It's a community statistic, and it's not just a community statistic, but they know how much they want to reduce it and by when. And they have 6 focus areas to do this. So again, they're not doing just one thing. In the previous example, you had one thing, we added a transportation route, that was the focus. It was a smaller scale initiative, but at the end of the day, it did transform a community. This example is a bit more larger scale, and they have 6 focus areas: resources, collaboration, law enforcement diversion, prevention, education, the reduction of stigma, treatment of people, so there's a lot of things that they're doing, and they're trying to tackle this issue from many different angles, because at the end of the day, they are trying to reduce the community-wide statistic by 50%. So that's going to take a lot of different supports to get there. So they identified the need through data, and again, they have a lot of partners to help with those 6 focus areas, from local and county government, and just a lot of other nonprofits. And then similarly, we have another example from Florida, which is even larger of a scale. They're trying to reduce poverty overall. So just the poverty levels by 30% in St. Petersburg by 2020. So again, they are looking at a community-wide issue. They have a set goal, and they know when they are trying to get to that goal. And again, for something like this, one thing is probably not going to help you get there. So they have multiple things. They have micro-business development, workforce development, economic development, collective infrastructure, and also family support. So as you can see, you have a mix of strategies and services working together to help you get there. And they use data to identify the issue, and they convene members of the community to form a group. It's a task force, and they're just planning out and basically making a strategic plan for getting to where they want to get. So those are some examples that we've identified of community transformation efforts. Again, some are really large scale, others are more small scale, but at the end of the day, they are changing something structurally. They're addressing more structural and deeper issues in the community. So to summarize, and I think we're basically just right on time. So to summarize, a community transformation initiative should have a concerted action plan. So again, that means you're working with a lot of partners, and you're working strategically towards targeted and measurable goals. That's number 2. To seek a change in a condition in the community. That's number 3. So all of these pieces together will help you identify if it's a community transformation initiative. And so with that, we have about 15 minutes for any questions folks might have.
I don't see any questions coming in, but I would encourage those who are online with us to ask your questions. I think you have given us quite a bit to think about, and understanding the difference of working for the community versus in the community. And I think that's a distinction that I think many agencies do struggle with.
Yeah, and I think that that's one thing that as we really started to dive into this community work, we started to recognize that there were multiple types of community work, and that working in the community is different from working at the community level, all of which are very, very important still. We still want to do the work in the community, but once you dive into it, it looks different, and there's nuances to that. So yeah, I think that that's a great takeaway, Christine.
Are there any questions out there for those who are attending this webinar? Okay, I think I have one that has come in. Let me take a look at it here. One question that's I'm sorry, go ahead.
No, go ahead. I was just going to say that we're always available, Muska or I, to answer your questions. So I guess we'll take the one that you have.
Okay. The question that has come in is, are you seeing any new needs across the country?
Any new needs? I don't think there's anything of note that would be new. I think what we've seen is we're learning a lot about what community action agencies are doing for community level work. We shared some examples for you. Every community is different and unique, but I don't think there's anything to note that would be something new.
Right, and we've reviewed over 800 submissions, so we're not necessarily saying new needs so much as just new approaches, I guess, to how folks are trying to tackle these problems to become more effective.
I think that's a great way to put it, new approaches. Things from community revitalization, the transportation example, poverty rate examples, certainly a number of agencies across the country working to reduce the homelessness rate. Yeah.
I think that something that to consider perhaps, and we've had a comment come in, is that many times when there is a community initiative program, there oftentimes is a companion program that kind of mirrors some of the work that's going on that would be considered family work. Is that something?
Absolutely.
Yeah.
And yeah, I mean, for example, I mean, if there's an agency working to reduce homelessness, I mean, they might also be working with people on the individual and family level. The other thing I want to note is that oftentimes in community initiatives, one way to reduce community level change is working at the individual and family level, right? And collectively, amongst all of the partners, you will create that community level change. So, right, if we talk about, go ahead.
Go ahead, Katie.
So, I mean, if we talk about, for example, the homelessness rate, you know, there's different strategies involved to get there. Now, simply adding something like shelter beds isn't going to reduce that homelessness rate, but adding shelter beds, having coordinated entry, you know, services that help people get into housing, into permanent housing, collectively help reduce the homelessness rate. And you're going to add something, Muska?
Yeah, I was just going to stir the pot a bit more. But you know, mostly it's complex and it's not really, you know, a black and white thing, right? So let's say if we just use this example we have on the screen with the reducing poverty by 30%. So Pinellas Opportunity Council is not doing all of this. They're not doing the micro business development work for, you know, they're not doing all of that. They have a bajillion partners helping them. And so, you know, one agency is focusing on the micro business development, another is focusing on workforce, or, you know, two agencies might be working together on the economic development. So if we, you know, let's just take a look at the workforce development piece of it. I don't know what in their plan this is. I'm just making up some stuff right now, but let's say this workforce development piece is employment training stuff, then your agency could be the one that's providing this employment training services. That's a service, it's an individual family level thing, but it's part of a larger initiative between multiple partners that does have other strategies. So you may not be the one necessarily engaging in like the community-wide strategies yourself. You might just be doing the service, but the initiative overall has other community-wide strategies from other partners in the mix, right? So again, you could just, your family level piece of it, as Katie was saying, could be one component of a larger initiative. But again, this initiative has to be a concerted action plan where, all partners are on the same page with the same targeted and measurable goals. So as long as you're all working towards this goal that they've identified for their initiative, which is reducing poverty by 30%, your small family level piece, if that's a part of it, then that's also included in that community initiative.
Are there any other questions?
Any other questions?
So I have a question. So we have done several poverty simulations for school districts, mainly in central Illinois. But what we've seen as a result of the changes in the school, which I guess you could describe the schools as community, is that in one school district in particular, they realized that they had a significant issue with hunger. And so they created a school district-wide program in which they make food available to families who need food on the weekends and over the summer. And it really has become quite a rallying cry, if you will, in that school district. So can we then say that we can directly link the use of the poverty simulation to raising awareness around hunger, and then with the school district's initiatives to build this feeding program, that would be the outcome, that impacting the community, meaning the community that's in which, the school district boundaries in which these individuals live?
So I think what I do here is that the poverty simulation is acting as a strategy for something, and I truly believe that. And we have poverty simulations listed in our strategies list in Module 3. I think, then you've got an addition of a food resource, and that could certainly be something that has changed and is reportable. But then, I would ask, what is the larger impact, right? I think we didn't have that slide in this particular slide deck, but we do have one that starts a conversation about that these counts of change are simply the catalyst for something larger, right? So if you've added a food resource, that could be community level work. I'd look at who the partners are and all of that. But then what else? What else has that had an impact on? Is there a reduction in the food security rate in the community, along those lines?
Right, thank you. I don't see any other questions popping up.
Well, and this is just the beginning. We know that this is a planning year for the HCCT work. We know that everyone across the country is in this process of thinking about what community transformational change is, what that looks like in each state and each community. So as we all collectively move forward, Muska and I are available to answer questions, to have this conversation again, in any way that we can help.
We really appreciate that. And I will just, to those who are on this webinar, I know that we currently here at the association are thinking through how is it that we could learn more about all of the community initiatives that our agencies are working within, and what we can do to really help the network dive into that. We certainly, in collaboration with our state office, DCEO, we are doing community engagement training, and we are weaving in elements of the HCCT. So we're launching the conversation, and we continue to work within this framework of helping us better understand and bring clarity to what community work is. So if there are no other questions, Katie, Muska, I want to really express my appreciation to you, and on behalf of all of us in Illinois, thank you for your work that you do for us on an ongoing basis, and thank you for sharing this with us today.
Absolutely. Just reach out and let us know how we can be of help.
We will do that.
Thanks for having.
Yes, thank you. Thank you. So I will go ahead and end this for everybody. And again, if you have questions, as both Katie and Muska said, please feel free to give them send them an email, give them a shout out, so we can really dive deeply into this work. So if you want to change the presenter back to me, I would appreciate that, Muska.
There you go.
Thank you. And let me show my screen here. Thank you. There it is. And move to our final slide. So our next webinar is November 20, as noted there on the screen. And we're going to spend some time on community action storytelling. Something that we want to dive into is that elevator speech. For those of you who work within Roma, know that that is an activity that is done at in-services, and I think it's something that we need to spread the love throughout our network regarding that, but also other places that we can tell stories and really dive into how is it that we tell our story, how do we frame it, how can we get it out there so people understand the work that we do. So once again, thank you all for participating in this. Again, my thanks to both Katie and Muska for their wisdom today. Again, we will make this recording available. We will send out the slide deck, and there also is a brief survey that does accompany this webinar. It should pop up after the end of this webinar, and then I believe it will be emailed to all of you again tomorrow. So thank you so much, and I will end this webinar for everybody now. So thank you. Take care.
Thank you. Bye-bye.
Bye-bye.